Many questions remain after the death of Junior Seau, with some wondering if depression was linked to his apparent suicide, or perhaps if the many years of taking hits on the field as a professional football player contributed. Here to look at the issue of depression is my guest, Dr. Stephen Ornish. He's a clinical professor at UC San Diego School of Medicine, Department of Psychiatry. So, Dr. Ornish, people are already talking about the fact that perhaps his apparent suicide is connected to depression, which could have been caused or made worse by head injury on the field. What's the link there?
Well, we know that there's a significant link between depression and suicide. Approximately 60% of people who have attempted or committed suicide are suffering from a very severe depression. The relationship between suicide and head injuries is less clear. There seems to be an association, but there's really very little research done on that topic, and whether or not there's a cause and effect relationship requires further study.
We heard that he was a very intense guy, even when he was a kid. I mean, is it possible that head injury might make emotions more intense?
Well, we know that head injuries, particularly severe ones, can lead to some what's called disinhibition, where the person does become emotionally labile. They do become more emotional and become more impulsive, but that usually occurs with quite significant and seen in more severe head injuries. We also know that you can have secondary depression from head injuries, and the important point is that depression, whether it's from a head injury or from any other cause, is really very treatable, and that the suicide ideation and thoughts of suicide often are stemming from the untreated depression, and it's the person's attempt to try to get away from a great deal of emotional pain.
And one of the other things that people always say about Junior Seau is that he was so outgoing and so friendly, so cheerful. I mean, is that the normal face of depression?
Well, the normal face is not to be outgoing and cheerful. The normal face is to appear depressed, to appear agitated, to appear anxious, maybe appear more like a bump on a log and withdrawn. That said, often we have what's called a smiling depression, where the person actually puts on a facade, where they look to the outside world like they're functioning just fine, and yet they're really crying on the inside. They're in a great deal of emotional pain. And ironically, sometimes it's the most famous people who feel as if they need to maintain a certain image, who feel a certain stigma about reaching out for help and getting help for what is otherwise a very treatable condition.
So there's always warning signs. There must be warning signs. Do you think some might have been missed in this case?
Well, the warning signs can be subtle to the loved ones and to the family. To professionals, though, they are often red flags. The kinds of warning signs we look for are particularly symptoms of depression, would be changes in mood. In men, often it manifests not in terms of a sad mood, but in terms of irritability or in anger. You can see changes in sleep, where the person may have trouble falling asleep, or their sleep may become very fitful. They may start making veiled references to that people would be better off if they weren't alive. That can be a big red flag. Sometimes they'll visit their primary care physician and express various symptoms that are hallmarks of depression. So often there are warning signs which may be missed by the family, but to trained mental health professionals are very apparent.
So I was going to ask you that. I mean, obviously support from family and friends is vital, but how important is professional support when someone is really suffering from this?
Well, professional support is really key. If any family member or friends believes that the person may be suffering from depression, it's very important to get them referred to treatment. This can be done through a direct referral. It can be done through a crisis line. If a family or friend thinks that the person is more imminently suicidal, all they have to do is pick up the phone, call 911, and the police with a crisis team will come out and do an assessment and determine whether or not the person is imminently suicidal. But again, it's important to recognize that depression, that the suicidality is a symptom, and it's often a symptom of depression. And the depression is very treatable. And so if we can get the person treated, then the symptom of suicidal ideation will just kind of melt away with the treatment.
But isn't it true that there is still a bit of a stigma to admitting depression, especially perhaps for men?
Well, unfortunately, there remains a stigma, and particularly among men, and particularly among athletes who have grown up in a culture of feeling as if they have to be very macho, have to endure a great deal of pain. In fact, that's what they're trained to do, which is to endure physical pain. And so when they have emotional pain, that same kind of culture of just toughening out this erroneous belief that somehow if they reach out for help, this is a weakness, quote unquote, that's very predominant in men. The other thing that makes depression and suicidality so dangerous in men is that men often turn to very violent and lethal means of attempting or committing suicide, such as we see in this case, as opposed to women who may overdose on medications or may cut on themselves, where they still may survive the suicide attempt.
Okay, we've come to the end of our time, but thank you very much for those insights, Dr. Ornish.
Thank you very much.